Looks like people are still coming in, but my name is Matt Meyer. I'm the Newcastle County Executive. Thank you, everyone, for joining us today for this really exciting announcement of a continued partnership between the people of Newcastle County and Delaware State University, one of the finest historically Black colleges and universities. In fact, one of the finest universities we have in our country. Delaware State University, led by Dr. Allen, has really been on the cutting edge, in the lead among higher education institutions in the country in COVID-19 testing, announcing in August a really ambitious plan to bring many more students back to campus than so many other universities are doing. We were proud to play some small role in that, and we're glad today to continue that partnership. Here in Newcastle County, as you may know, we have done everything possible to make sure that we are testing all residents for COVID-19 on a regular basis, that any resident, regardless of symptoms, regardless of pre-existing health conditions, regardless of what health insurance they may or may not have, has an opportunity to get tested. So as we're spending in collaboration with the state, really tens of millions of dollars on testing, it occurred to us several things. Number one, we our COVID-19 testing capacity to increase. We don't want to ever turn anyone away today or in the future because we don't have enough testing capacity. Second, we want to process tests more efficiently. As everyone listening today probably knows, people want tests faster. They want results that are more reliable, and we want tests to be less expensive. Less expensive tests enables us, obviously, to do more tests, getting a better deal for taxpayers. In addition, we like to enhance the capabilities of local universities. These tens of millions of dollars that we've been spending on testing, really high quality testing companies, are almost entirely out of state. So we've been spending money to send tests to California, to Texas, to Washington, D.C., to New Jersey. So one thought was that how do we in-house, in-state some of this testing capacity? And out of that is born this partnership that we're announcing today, where we're intending to invest up to $5 million of CARES Act money to open a next generation genomics lab at Delaware State University's Wilmington campus, which is on Kirkwood Highway in Newcastle County. It's an exciting turn of events. We can describe a little bit more about some of the details, but as of now, we intend for this lab to be up and running, processing its first tests within about 4 to 5 weeks. So without further ado, why don't I hand it over to one of the top academic leaders, one of the top thought leaders and strategic leaders of any college and university in the United States, Dr. Tony Allen.
Dr. Allen, you're muted.
Executive Meyer, thank you very much for that warm introduction. I continue to admit literally hundreds of my faculty who are here for this wonderful announcement. So thank you to all of my Delaware State University family. I should start off by saying Executive Meyer has been modest with respect to his support for Delaware State University. He literally provided the initial seed funding for our testing protocol, and we do think it's one of the best testing protocols in the country. We had some reports, my latest report I get every Monday. We have now administered 30,000 tests, 30,000, and our positivity rate is still 0.3%. So while we are continuing to model all those things that we know are important, that the CDC guidelines tells us are effective, we also know that the support from our broader community, particularly our leaders like Executive Meyer and Newcastle County more broadly, is very important. I also want to call out Dr. Derek Scott from our Biological Sciences Department. Without Dr. Scott's vision, energy, and intellect, we would not be here. He's an incredible scientist, a young incredible scientist, and is really making a way for us to have this unique opportunity. Also, Dr. Sandra DeLauder, who's our provost and leads our academic enterprise and has at the forefront of her efforts building our intellectual capacity, not just to instruct our world-class students, but also to solve some of Delaware's most pressing problems. So why is this important for us? A diagnostic facility of this kind enables us to join in the fight, most notably in support of our neighbors and community members in the state of Delaware. It is true that it builds our capacity as it relates to COVID testing, but also as it relates to other infectious diseases. So over the long term, this could be and will be a hub for the region, which we believe is important. I can also tell you that this is going to build some capacity for good paying jobs and key scientists in this area. And it will continue to build our capacity in Newcastle County, which we think is important. Executive Meyer talked about being located at our Kirkwood facility, which is run by former Secretary of Labor and now Dean of our School of Continuing and Adult Studies, Dr. Patrice Gilliam Johnson. So it does give us import in an important part of our state. And as I've always said, makes us really Delaware's apostrophe S State University. So we're really proud of what we're going to be able to do here, how we're going to be able to help in the process directly in fighting COVID-19, but also in broader infectious diseases over the long term. You can be assured that the learning with respect to not only our world-class scientists, but our students is also going to grow exponentially as a result of this opportunity. What we've seen from our testing protocol at Delaware State is not just an ability for us to have vendors and unfortunately outside vendors come in and help us in this process, but also build sweat equity. We've been told from the very beginning that you need to have the entire university community engaged. So when I think about our Department of Public and Allied Health run by Professor Chris Mason, I think about our athletics program. Many of our student athletes have jumped in, and many of our other student groups. It is not only an opportunity for us to hold each other accountable and protect each other against this terrible virus, but also to create some new learnings, which I believe are going to be the new frontier for many students as we think about public health more broadly. And that is particularly important for communities of color. I don't need to tell anybody on this call what it means with respect to the disproportionate realities of things like COVID-19 affecting communities of color in a significant way. And we can't always just be the affected. We have to be a part of the solution. And this is one unique, bold opportunity by Executive Meyer and Newcastle County to help us do just that. So I just want to extend my great thank you and gratitude to you, and hope you recognize that you are with a partner who wants to deliver not only for our students, faculty, and staff, but also for the entire state of Delaware.
Thank you, Dr. Allen. I also wanted to mention outside groups that and individuals who are extraordinarily helpful. These resources are coming from Federal CARES Act money, which almost certainly would not have been possible without the strong advocacy and support of Senator Carper, Senator Coons, and Representative Blunt Rochester. Did I say Secretary Coons? I meant Senator Coons and Representative Blunt Rochester. And in addition, Testing for America, which really worked hand in glove and has been working very closely with Delaware State University on their testing protocol, was also absolutely critical. And in particular, Dr. Joan Coker and Dr. Neil Hochstein have been absolutely critical working with Dr. Scott at Delaware State University, as well as our team, Will Davis, Max Williamson, Andrea Almond at Newcastle County.
Matt, are you ready to take questions?
Yeah, sure.
Okay, anybody in the media who has questions? I guess we've got a lot of you in here, but you raise your hand and we'll try to get one at a time or jump in.
I see Brandon from the News Journal.
Hey guys, thank you for having us. This can go to Matt or Tony. What, once everything's ramped up, will be the testing capacity of this facility?
defer to Dr. Scott.
Dr. Scott, are you in the call?
Yes, can you guys hear me?
Yep.
Right now, we're scheduled for a few tests in December, but leading up into January in 2021, we are ramping up to about 1,000 tests per day as the capacity that we're shooting for.
And how will the cost of these tests, generally speaking, compare to tests that the county has been providing over the last couple of months?
So that's actually one of the best things about this new protocol we're trying to use. So we're thinking of going to the Yale-based model, which is the saliva-based model, and essentially we get to skip a step that's very time intensive and expensive, which is the extraction process. So we're able to go straight from saliva to do the actual testing, which will highly decrease costs because a lot of the cost is involved in the reagents that you need to do the RNA extraction. And so we can, the last estimates, you can get tests for as low as $1.30 up to about $4 per sample, which is a huge cost to traditional way of using the kits.
When we started with Curative in June, we, in partnership with the state, were spending $150 per test. And the cost is, I believe, come down some, but it hasn't come down that much. We're spending, I believe, in the neighborhood of $90 to $150 per test because of additional services, the software platform, and other things. It may turn out with Delaware State to be more expensive than $4 or $5 a test or $1 a test, but not that much more expensive. There's obviously going to be, over time, huge cost savings.
Yeah, just to give you a sense of with respect to our testing here at Delaware State, we're averaging around $50 a test. We've been fortunate to have some wonderful donors help us in that support, but just think about getting even down from that to the amounts that Dr. Scott and Executive Meyer were mentioning. Really builds capacity and supply over a longer time horizon for many more than our Delaware State community, but folks throughout the state of Delaware.
I see Jacob, Jacob and Amy. Jacob, do you want to go ahead?
Yeah, it was Brandon done? I don't want to cut off Brandon as well.
Good. Thank you.
Okay. Couple things, guys. I'm wondering where you're currently processing tests. Obviously, this will replace wherever you're currently processing.
Do you want to go ahead, Dr. Allen, with your Delaware State tests, and I can explain as well?
Sure. I'm turning it over to my enterprise risk officer and our COVID chair, Attorney Lucretia Moultrie. Lucretia, you want to take that question?
Sure. Everyone. Currently, Delaware State University is using a vendor called Garden, who works out of California.
And the county, we have 2 testing vendors, I believe we're working. I don't know if Brian Boyle, my test guy, is on, but there are 2 primary testing vendors we work with now. One is Curative, that has laboratories in California, Texas, and Washington, D.C. Almost all of our tests now go to Washington, D.C. We also work with LabCorp, and LabCorp, I believe, does the test processing in New Jersey.
The latest group went to Massachusetts, actually.
There you go. Thanks, Kyle.
And in terms of turnaround times on your guys' tests, I'm assuming that having the lab here closer will lead to faster turnaround times. What are you averaging, I guess, on turnaround time for your tests to the different labs you guys are currently using?
We're averaging now at Delaware State between 30 and 36 hours with respect to turnaround time. It depends sometimes on the nature of the day with respect to processing. But as you know, this will be much more of an immediate reaction for us, which I know will help the broader community.
And is the goal, I guess, then to get to same day testing or within a few hours? I guess what's the hope for the turnaround time with the new lab?
Dr. Scott, you want to take that one?
Yes. We are able to, if we get samples in the morning, we'll have results that day. It depends on exactly how we roll it out, but I couldn't imagine it being taken more than the next day. With samples received that day in the morning, we should be able to have information that same day.
Gotcha. And all of the workforce for this new, the positions you guys say you're hiring, will they be just kind of private, specifically tasked with doing these tests, or will they be faculty at DSU? I guess, how will they be categorized?
Go ahead, Dr. Scott.
So we're looking to get those positions up this week, and essentially we can have anyone who applies for it and who's eligible for the job. One of the things that's going to be limited is a lot of these positions actually require CLIA experience. So any researcher that has that kind of experience be eligible to apply for the job.
Okay, but I guess their role will be purely work, not to teach courses or anything of the sort at DSU in conjunction with it, correct?
Got it. Yes. So that will be the actual diagnostic side. But now that you mentioned it, we also have a capability of academic side where we're going to have students there as well, graduate students. And the hope is to expand into research and to add that research branch along with the diagnostic capabilities.
Yeah, and you might remember, as I said in my opening comments, one of the things that makes this most attractive to us is the capacity to engage our undergraduate and graduate students in this type of clinical work. So building capacity along those lines is really expanding our research portfolio over time and creating more opportunities. We already are noted really as a result of the work of Dr. Clutrice Watson, our associate provost, for doing more undergraduate research than many other institutions in the country. This just enables us to do that more broadly across our writer portfolio.
And so just lastly, kind of dovetailing on that, at some point COVID will hopefully not be a thing anymore, but you will still have this lab. Is there any idea on how you might position this resource for future research in a post-COVID era?
Yeah, we think it's going to be a key operator for fighting infectious disease more broadly. So not just COVID. Again, that's the attraction of it, that there's a moment right now that we're dealing with that is unlike anything we've seen in our lifetime. But we also know that being able to combat infectious diseases and having the research capacity and clinical capacity to do that in a regular fashion is very important, particularly as it relates to location. Being able to have that in-house in the state of Delaware will put us ahead of the game as we get through other situations of this ilk.
And if I can add, from my perspective, it does two things beyond COVID-19 that are very helpful in terms of public health. One is that you may recall back in January, I believe it was in Wuhan in China, they actually mapped the DNA of this virus. So the scientific knowledge was there to fight the infection and fight the contagion, but the laboratory resources and other resources were not yet available in the United States. And that 4 or 5 or 6 month lag cost lives in our country, and I believe cost lives here in our community. We're now in partnership with Delaware State able to have a lab that if there's any future threat like this that comes, we have the machinery and the know-how to immediately take that scientific knowledge from China or from wherever it comes in the world and put it to use to keep our community safe. That's the first thing. And the second thing is based on medical professionals I've spoken to. Right now, when I go to the doctor asks me my mom and dad's family medical history. But the sort of next generation of medicine is you use advanced genomics, so you don't have to look at your family medical history. They can actually look at my DNA, and this machinery enables us to do that in a way that could really have a dramatically positive impact on health here in our community, particularly for underserved communities.
The only other thing I had to ask was, is this the only, I think there's only one other lab in the state, the state health department lab that's capable of processing these COVID tests. Am I correct in that, other than this one, or are there other resources out there to process these tests?
I know Nemours does some processing in-house. I said at AI DuPont Hospital, I believe Christiana Care Hologic machine, and I think Christiana Care may be able to process some. I don't think there's any resource in the state that can process them on this scale.
Yeah, that's what I would say, Executive Meyer. The scope of what we're able to do here is much more comprehensive, and we believe will be effective in real time across a number of fronts.
Thanks, everyone.
Amy, you had a question.
Yes, thank you. Two questions that I have. I just want to try to understand the flow of how we know where tests are going. So like, for example, if I get a curative test at the Claymont Community Center, is it going to this testing lab and I can expect down the road this same day turnaround? How do we know where the test is going to be processed?
We'll see. Right now, until this lab is up and running, all of our county testing assets will go to Curative, which is now, as I mentioned, almost certainly their Washington, D.C. lab. The general idea is build capacity, and then the demand is there for testing. We'll find demand to send to the capacity. So we may set up test sites that run directly to this lab as early as December, or we may not, depending on how the demand is taken up. Maybe Christiana Care is a potential partner. They're doing obviously a lot of testing within their hospital, as is Nemours, as is BB, the hospitals across the state, and they may want to access this Delaware State lab in addition to our more public sites.
Okay, so you as a consumer then getting the test wouldn't necessarily know where your test was going to be processed, at least in the beginning.
I think that's right, with the caveat that we're not hiding anything. Like when you go to, I was actually at our curative site today, and you get something that says this is a curative test to give you, if you have any questions about the sensitivity or specificity, the quality of the test, it gives you the information. So that's right. We don't sort of announce this is a test site and it's Delaware State's advanced genomics test, and this is another test site that's curative. We just say it's a test site. But if there's additional information that's wanted, we're happy to give it out.
Mm-hmm. Yeah, sure. I was just thinking, if you really wanted that same day turnaround and that was something that lab could offer, that would be somewhere that you'd want to go. Understood. What's the total cost of the project? I understand the $5 million investment, but total, what does this cost to do?
When you do something this quickly, it's hard to say for sure. We estimate it will be about a $5 million project to get all the machinery and people up and running by, in December.
Is it in an existing building, like a structure that already exists?
Yes. I don't. Dr. Scott maybe can handle that, or I don't know.
Yeah, let me just start, and I'll turn it over to Dr. Scott in a second here. Just keep in mind, as Executive Myers said, this is in the old Armory Reserve on Kirkwood Highway, which we've been operating for a number of years now through the U.S. Department of Education. So we offer a fair amount there with respect to adult continuing education and some testing facility as well. But we have some unused space that is perfect in this view for this kind of project. So this is adding on to an existing Delaware State University facility, both as it relates to diagnostic testing, capacity for ongoing teaching, education, and research. Dr. Scott, would you add anything?
Yeah, sure. Like Dr. Allen mentioned, this is a very great opportunity because there's a lot of unused space in the building. And so we're going to be able to take advantage of about 5,600 square feet of unused space that we're going to be renovating. And we're going to kind of use that wing for the diagnostic facility.
Thank you, guys.
Excellent. Ken, I think you were next. Just remember to unmute yourself.
Okay, thank you. Next year, after the CARES Act funding ends, how will this be paid for?
Now, I'm happy to start. Obviously, we've made a commitment to staff the facility based on our own academic enterprise. What Executive Meyer has really done is helped us build the nuts and bolts of this, and as well as buy the appropriate equipment that could make this ongoing. But we see this as a critical part of our strategic advantage moving forward here. So it'll be an ongoing part of our operating budget.
And Ken, to be frank, maybe too frank, my point of view is that maybe my most important responsibility to the people of this county is to keep them safe and healthy. And right now that means making sure testing is widely available, processed quickly using the latest technologies. I understand, I think we all understand, there are limitations with funding and rules, and as of today, it's going to expire the end of the year. My obligation to the people of this county does not end December 30th with CARES Act funding. We need to find a way to make this work, and we will find a way.
Thank you.
Jacob, so you had another question.
Yeah, just real quick. I just wanted to clarify, these are PCR tests, correct? Not antigen tests?
Yes.
Yes, that's correct. RT-PCR.
Thank you.
Any other members of the media with any questions? All right, Matt, I think if you want to wrap it up, I think we're good.
Yeah, just thank everyone for coming in, and thanks especially to Dr. Allen, Dr. Scott working so hard on this, along with Lucretia and Dr. Gilliam Johnson. It's an exciting partnership, another step forward that's going to be a huge asset and a huge benefit to the people of Newcastle County, really the people of the state of Delaware, and to Delaware State University. We look forward to reaping many years into the future. Thank you.